All right, I think we are starting to stabilize everyone. And also we have content and we have to get through it. So I'm going to start to get us moving. Thank you all for joining us today. I hope you're all here for our OHP 1115 Medicaid waiver monthly webinar series. So we have an update today on May 3rd, 2023. And we'll be talking about a few very specific things. So I want to start right off the bat with, if you want a broad overview of the waiver, we do have other content we can point you towards. We're trying to break up different aspects of our waiver and our OHP work into these different webinars. So you'll find that this is not going to be the be all end all of everything to know about the waiver, but we have a few specific topics to talk about. As a welcome, we have some ground rules for us all, which is if everyone can keep themselves muted unless called on. We are recording, so you will have access to this and you'll be able to send it to colleagues, anyone who may need it, and it will be on our public website as well. And at any point in time, either during or after this webinar, you're always welcome to use our 1115 waiver.renewal email to let us know if you have questions, concerns, comments, or any other feedback that you want to give us around the 1115 waiver. We actually continue to have quite a few folks joining us, but we will continue. We're going to do our best today when we're talking to do things like introducing ourselves, which I haven't done yet, so I'll do that next. Giving visual descriptions, talking a little bit more slowly and pausing for our closed captioning. And we are going to do our best to explain acronyms or jargon if we are saying it. But I also want to welcome you all to hold us accountable to if we are starting to speak in acronyms or jargon and haven't noticed it. So please do not hesitate to call us out on it and put information in the chat. I will be our presenter for today. I think I'm going to be doing a vast majority of the talking. So my name is Jessica Diaz. My pronouns are she, her, and hers. I am a middle-aged, which still sits strangely with me to admit it about myself, woman, light-skinned Latina, late 30s. I have shoulder length, dark hair. And I'm going to ask Sully and Molly to introduce themselves as well. And then if anyone else wants to introduce themselves, please do so in the chat.
Hi everyone, Sully Rosales. I use she, her, ella pronouns. I'm a community engagement coordinator, and a visual description of myself. I'm wearing a light mint color shirt. I have my hair half pulled back, it's brown, and I'm a light-skinned Latina woman.
Good morning, I'm Molly Taylor, she, her pronouns. I have blonde, short hair, and I'm wearing a bright pink sweater with a blurred background, and I will be manning the chat. Welcome, everyone.
Thank you so much. And I see that some folks are starting to introduce themselves in chat, and thank you so much for doing that as well. I think we'll move ahead. So I mentioned at the top of the presentation that we have a few topics we want to focus on today. And these are to go through our health equity and community engagement commitments here at OHA. And we're going to try to always start our presentations this way. So if you were here last month, you will see wording that you recognize. We want to really bring it down to basics and start from the viewpoint of first step to being able to get and use these things that we are offering with our Medicaid waiver. You have to have OHP. So we're going to talk a little bit about getting and keeping OHP to start us. We're going to talk about some of the special rules that happened during the COVID-19 public health emergency, as well as the fact that it is currently unwinding and those rules are changing again. And then we're going to talk about what the new waiver continuous eligibility means within the framework of the systems that already exist. So we're going to talk about sort of where we've been, and then we're going to end with where we're going when it comes to continuous eligibility, which is one of the things that is in our current 1115 Medicaid waiver. And then we're going to end with some time for feedback and questions. And I will say also, please feel free to put in feedback and questions in the chat throughout, regardless of if it is a time for official feedback and questions. All right, I'm going to start us out by reading out loud our health equity goal here at OHA. Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments, to address the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and contemporary injustices. And here's our commitment to community engagement. We acknowledge the state of Oregon and its systems has perpetuated institutional, systemic, and structural barriers that have silenced the voices of communities over time. We recognize community engaged health improvement is a long-term and adapting process. OHA is committed to meaningful engagement with communities via traditional and emerging mechanisms for community engagement. We are committed to transparency. Information will be openly and honestly shared so everyone has the benefit of the same information. We welcome feedback about how to make community engagement more inclusive and accessible. So that's actually where we're going to end today. We're going to always be asking you all how we can better engage you, how we can better engage the communities you serve, the communities you are a part of here in Oregon. But first, we're going to switch gears and we're going to talk a little bit about the Oregon Health Plan and how people can get, use, and keep their coverage. So first off, what is the Oregon Health Plan? So Oregon Health Plan is Medicaid in Oregon, and Medicaid is the nation's public health insurance program for families, individuals. There is technically a piece in this called CHIP, Children's Health Insurance Program. We're going to be using the phrase Oregon Health Plan to include all of those things. And it is free health coverage available to children, teens, and adults who live in Oregon and meet income and other criteria. People can apply for OHP at any time during the year. Applications are never closed, it's always open. And people can apply for OHP multiple times during the year as well if their situation changes. Next slide, please. We do want to make a very quick distinction that Medicaid and Medicare are two different systems. Medicare is a federal health insurance program that is for people who are 65 and older, people with disabilities, and this can include people who are younger than 65, as well as people with permanent kidney failure requiring dialysis or a transplant. So Medicaid and Medicare are terms that a lot of people use interchangeably in their day-to-day lives. And it is possible to have both at the same time. That's something that not everyone is aware of. So depending on your circumstances, you can qualify for full OHP as well as Medicare. And there is also a program called a Medicare Savings Program which sounds like Medicare, but is actually a way that Medicaid helps to pay for Medicare for people who have to pay for their Medicare. We estimate about 7.7% of people on Medicaid in Oregon also have Medicare. So it's just to start to situate our different systems and how they interact. Next slide, please. There are different programs for OHP with different rules for eligibility, but generally speaking, these are the factors that we need to know at the state to see if someone qualifies for the Oregon Health Plan. First off, people must live in Oregon. They must have Oregon residency. Depending on household size, there are different, and household size and program, there are different income levels that people can qualify for OHP. We also need to know about people's citizenship and immigration statuses, any statuses that they have. We need to know age because, for instance, children can qualify at different income rates than adults. Pregnancy is also a factor that can adjust eligibility factors, as well as if people have other major health coverage. Some programs take into consideration disability, Medicare eligibility, and refugee status. And some programs also do require a resource test. So in addition to income, what other assets and resources people have. And that tends to be the programs that live over with aging and people with disabilities. So depending on a household's information, there may be different pieces that the state needs to collect in order to get an accurate eligibility determination. Next slide, please. OHP covers a lot of different things in the realm of medical, physical health, dental health, behavioral health coverage, and more. So when we talk about physical health or medical care, that's things like checkups, getting vaccinations, tests, and other procedures, accessing urgent care, emergency care, being in the hospital, physical, occupational, and speech therapy, and a whole host of other things. It includes dental care such as cleanings, fluoride fillings, and extractions, vision care for children through the age of 21 and for pregnant women is included, includes a wide range of prescriptions, behavioral health services such as therapy, counseling, medication management, helps with addiction services to things such as cigarettes, alcohol, and drugs. It also includes rides, so transportation, whether it is emergent or non-emergent, that is covered. And just as a note that we do have some folks, adults between the ages of 27 and 54, who maybe do not meet the qualifying immigration status requirements. There is something called CAWM, which is emergency coverage. So there is full OHP, and some people may be on emergency only care. This is a thing that changes each year. Actually, we're having some pretty exciting legislation that's been in the works. So expect that a year from now, this slide may look a little bit different about that emergency care bit. Next slide, please. So I have some information here that you will also see on future slides, because I think this is one of our central things we want to share today, which is when we start to talk about the ways in which people can have access to things like health-related social needs care, housing, nutrition, when we talk about people being able to get continuous eligibility and the other really cool things that the waiver is focused on expanding our OHP here in Oregon, step one is having OHP. This is only going to be accessible to Oregon Health Plan members. So step one is getting into our systems. And there's a few different ways that people can do this. We have an online applicant portal at one.oregon.gov where people can sign up online. We have certified assisters who can help people navigate our systems. And it really is this online application process that is the fastest. You can get an immediate determination. We do also have a paper form. It has a form number of 7210. It comes in physical format that you can hold in your hand and write on, and it also comes as a PDF that can be filled out electronically. People can apply via phone directly with the state of Oregon, and that's this 1-800-699-9075 number. And people can also apply at any local ODHS office across Oregon. I do want to make a plug for our assisters. Those are humans who work, volunteer at a variety of organizations and settings across the state and can talk to members one-on-one about what it takes to apply for OHP and help them through the process. And we do have a website where people can find local assisters who are available to the public. And there are many more who are also located within clinics, hospitals, nonprofit organizations, faith-based organizations, a whole range of different places where people can get help either in person or on the phone. And that is oregonhealthcare.gov/gethelp is how people can find application assisters. Next slide, please. Another important part of this is not only getting OHP, but making sure people can keep OHP. And as we talk about keeping OHP, there's a few different moving parts, and this is where eventually our talk about continuous eligibility is also going to play a role. It's important that people who are on OHP report changes when any change in their circumstance or their household happens. It's important that people respond to any notices that are requesting information or requesting updates, and people will also sometimes get something that is a renewal notice. So it might not be for specific information, it might be for a more broad set of information about a case. A few examples of the changes that people need to report, and people are asked to report within 10 days, but I would say the sooner the better, and it's never too late to report a change. If income changes, and I would say about on a monthly basis, if monthly income changes, it's really important if someone changes address or residence, because if people do move and we don't know that they moved, then we're not going to be able to successfully get them the notices that'll let them know that we need something from them. Any change in a legal name for anyone who's receiving OHP, we do need to know about if anyone in the household gets, loses, or changes their health coverage. If anyone joins the household, leaves the household, if someone becomes pregnant, when a pregnancy ends, if someone passes, if someone moves in or out. And then also if people change tax filing status, that is important as well. And these are just examples. There are more things that people have to report. But these are some examples that might not be on everyone's mind as they are navigating changes in their life. If they are on OHP, then it's really important that that information gets to the state. And let's go to the next slide. You'll notice this slide looks really similar to the one about how to get OHP, and that is because it really is all the same resources and places that people use to get OHP that they can also use to keep their OHP and to report changes. And so you'll see the applicant portal is listed here, that same phone number, a local ODHS office, and then once again, a plug for getting a certified assister to help you navigate through this process, especially when it comes to reporting changes and helping people understand what changes they might need to report and to talk through it with a human. And so that this duplication, that's the word I'm looking for, is very much on purpose because we really do want to hammer home. It's really important to be in communication about your OHP once you get it. And it's really all the same places that people originally went to get help or to navigate our processes here at the state. And we can go to the next slide. All right, so let's talk a little bit about the COVID-19 public health emergency and the special rules and changes that have happened over the last few years. So between March of 2020 and March of this year, 2023, there were special things put into place to make it easier to maintain medical benefits. And that is due to something that we're calling a public health emergency period. Benefits did not close for OHP during this period for just about everyone. There were a few ways in which people could lose their benefits, but things like your income rising, changes to your household, non-response, those things did not trigger benefits to close during the public health emergency period. So a lot of people kept OHP where historically they may not have. Also, a lot of people found it easier to qualify because a lot of the steps like submitting copies of pay stubs, showing up in person, those things were also able to be put on pause due to those special rules. And we also added in additional coverage. So for instance, we were able to add in a lot of very quick changes to what is covered by OHP to really work towards COVID-19 prevention, vaccination, and treatment as well. And this is just a small, many other things happened through the emergency period, but these are some things related to OHP. Next slide, please. And as many of you may know, these special rules have now expired when it comes to a lot of these OHP COVID-19 emergency special flexibilities. So by mid-2024, at the state, we have to check and see if all 1.5 million members who are on OHP right now are still eligible. We have new guidance from the federal government about some of the parameters for that. So for instance, we are required to spread out the renewals across at least 10 months. We have some flexibility in how we're doing it, and we are calling that, you might have heard the phrase public health emergency unwinding. So that's the process of going from our special rules back to normal rules, and in some places, creating new ways of doing business within, gosh, new normal is a phrase that has been used a lot during the pandemic, but we are in a new normal phase once again. So there's two ways that this can happen. We try to put everyone through a process that we call auto renewal, which is we're going to try to use our systems at the state to verify information and to do as much as we can to see if someone is continuing to be eligible for OHP. If people are still eligible, they will get a notice that lets them know that their benefits have been renewed. If it looks like they're no longer eligible, then people will be notified of an end date that is at least 60 days into the future from when the letter goes out. And if this auto renewal process, we can't do it for a household, and there's a whole bunch of reasons why people may have information that we need to verify manually, not through our automated processes, then we will send out mail that will let people know we need information, and they will have 90 days to provide that information to us at the state. Next slide, please. So when action is required for renewals, there's a few different things that it may be. So people will get a letter, and it's going to outline what information is needed. It may look like a request for information for a specific piece of information. For instance, that we need to get information about their current income. It may be what is called a full renewal, or sometimes you may hear the phrase active renewal. And that would be a whole big renewal packet that gets sent in the mail. And then for some programs, there may be a requirement to do an interview, which most likely will be on the phone. And so whatever next steps a household needs to take, that information will be in the notices that they receive from the state. There will be 90 days to respond to any of these renewal notices. It is possible that multiple things may need to happen, or we may need multiple pieces of information. We do have times where there's returned mail. Right now, we're expecting about 10%. If someone is still eligible, but they miss getting that notice, getting their renewal letter, there are opportunities for folks at the state to reopen a case up to 90 days after it ends. And so for some folks who have been working in OHP for a long time, some of this will sound familiar. And for some folks who are newer to navigating our systems, this may be a pretty big change from how the rules were during the public health emergency. And I'm sure that there are many other places where this is being discussed, but we just want to do a really broad overview. So we're not going really deeply into the weeds. Next slide, please. And to try to put that into perspective a little bit, we have a timeline to walk through about how this unwinding is working. So we are doing our renewal process in monthly batches. And so between April 2023 and January 2024, this is where we are unwinding those special rules and checking everyone's eligibility based on our new rules, the new old rules in a way. So April of 2023, the very first batch of medical renewal letters were sent out, and letters get sent out mid-month. That means that the very first closures, and that would be for households that automatically renew or respond very quickly and are found ineligible, that would be the end of June. July 31st would be the deadline for the folks from that first batch of renewals who we asked for information or specific responses. September 30th would be the very soonest someone would close for not responding to that initial request. We expect that by the end of September, most April renewals will be resolved unless there are multiple steps that people and the state need to work through together. December 31st would be the end of the window to reopen cases from that April batch. So that additional time that people have where we can reopen cases even if they have closed. And then by January of next year, then we've gone through this whole process that we've just laid out for everyone. So that's the final batch that is this new set of rules. And so if someone gets that medical renewal letter that gets sent out in April, it goes through this process, but we have another batch that goes in May, in June, in July, and every month moving forward. So it's going to be quite a while before everyone has been fully through the unwinding process. And let's go to the next slide. So here's the main messaging to folks as we go through unwinding for members. Between now and 2024, everyone is going to get a renewal letter, at least one for each household. The best thing to do is to keep your address and other information up to date and to wait for that letter to arrive in the mail so that you can read it and follow any instructions that are on it. There are a whole host of ways to get help or report changes. And this is where I would point you. Right here, we have benefits.oregon.gov. Also, an assister, walking into an ODHS office. There's the phone number. There's the online applicant portal. There's a lot of options for how people can see information about their case and learn if there's anything they need to do. And I did say that every household will receive a renewal letter. And we can move on to the next slide. So a little bit more about how we're expecting folks to be affected by this unwinding process is we have about 1.5 million people currently on OHP. We expect a vast majority of them to be continue to be eligible. goodness. So most people will continue to have OHP moving forward. There is an expectation that up to about 300,000 people may no longer be enrolled because they are ineligible or because they haven't been able to navigate our processes. There are many options for people who are no longer eligible, and some of them are listed here, such as going to the Oregon Health Insurance Marketplace. We do have a bridge program and basic health plan, and if you're interested in that, I'm going to point you towards other resources because we don't have time to go over it today. And then there's also other coverage, such as if people get their health coverage through their job, through Medicare. So there are different opportunities that are not OHP for people to get covered if they're not eligible for OHP. And in fact, I think we have the next slide that goes through some of these different options and some of the different places people can pursue coverage. So questions to ask folks who are losing their OHP is, are you eligible for Medicare? Is there affordable coverage with someone in the household's employer? If the answer to both of those is no, then the marketplace is a really great option for folks. And then also, as situations change, people may become eligible for OHP again. We look at income on a monthly basis. So it could be a situation where someone could go over income and then be able to apply the very next month if their situation changes. And if we can go to the next slide, where we get to my favorite part of this presentation, because we talked about the rules as they have existed so far. And now we get to change gears and talk a little bit about some new ways in which we can keep people on OHP that are built into the 1115 Medicaid waiver. And so the good news is, starting July of this year, Oregon is going to be able to provide continuous eligibility for children through the month in which they turn age 6. Regardless of when they first enrolled in OHP, and regardless of changes in circumstances, like a change in income, that would otherwise cause them to lose their eligibility. We also get to offer 2 years of continuous eligibility for people age 6 and older in those same situations. So for instance, if income goes up. As a note, we're going to talk about things that apply to almost every kind of OHP, but this does not apply to long-term care services and support. So that's just one caveat I want to give. There's a difference between the long-term care services and the medical services that we're able to offer. So we're going to be talking exclusively about those health coverage services. Next slide. So let's talk about what we mean when we say continuous eligibility. So continuous means that the coverage will continue. This means that renewals for people will start to happen every 2 years instead of every year. So this process we just laid out about how everyone gets a letter every year and they have to respond to it if we have anything we need, that's going to happen on a 2-year period. And then those special rules for children up to age 6 means that a child could continue coverage in situations beyond those 2 years. So maybe a whole family is getting a renewal packet, but the child under 6, regardless of if they are able to respond to that packet and get the information in the state, would keep those benefits. And eligibility continues even if the household information changes, the big one being income. And it is important that even though there will be sort of this there's a longer timeline before we do our automated processes, it's still important that people keep their information up to date. And that there are some situations where people would lose continuous eligibility. For instance, since we do OHP in Oregon, if someone is no longer an Oregon resident, that would not be one of those things that applies to continuous eligibility. If you leave the state and you permanently move, then you are no longer eligible for OHP, even if it's within that 2-year period. Why are we doing continuous eligibility? It makes it a lot easier to plan healthcare in advance, and to really avoid those situations where people are popping on and off OHP, or they have costly and disruptive changes in their coverage that really stops them being able to access the care they need to be healthy. So we're really looking at those health outcomes and impacting people's overall health by giving them more stability with their health coverage. And so that's why I'm so excited about this portion. After we went through all the nitty-gritty about like, here are all the rules and here's all the things you have to do, starting in July of this year, which is now very soon, we're already in May, there's going to be a lot that we can do to really lessen that burden on reporting to us and responding to notices, which is really exciting to me. Next slide, please. So here's a timeline similar to the one we gave around unwinding to start to put this into a calendar and start to think through what that might mean for people who are on OHP right now. So right now, we're in a situation where the public health emergency has ended and our renewal process, our unwinding process has begun. People are getting renewed in monthly batches, that process that we walked through a few minutes ago. In July of 2023, that's when our new continuous eligibility rules will be fully built and operational in our systems, which means that people who were renewed through these batch processes as far back as May, we will be able to retroactively apply these rules to them. So it's not that someone who like, oh, you got renewed in June and therefore this doesn't apply to you, just because the paperwork didn't say it in June, doesn't mean it doesn't now offer additional continuous eligibility protections for folks. And so this will then start moving forward July 2023. These rules will be in place, and it is retroactive to the folks who have been through this unwinding process before we updated our system. So the systems are going to do a bunch of stuff, additional work, to make sure that we process households even if they renewed before this time. This is a process that has a few different pieces to it. So even though we're very close to completing building these changes to get the rules to work right. Some of the notices, some of the systems may still say wrong dates in them. So just want to prep you all for that. It's probably going to take a few months. So later on in 2023, when all of our notices and our systems are all aligned to do and say what the rules are changing towards. Oof, that was quite a sentence I just said. The main thing that I want to impart to you for that is that there may be this short time period of a few months where what it says on the paperwork people get or what it might say in the one system is going to be a little bit different. And it may be it may have a renewal date listed on it that's a year away instead of 2 years away. And just know that that's something we're going to continue to work on fixing, but it's just going to take a little extra time. This is a pretty big ask to get all of our systems in alignment. And so we prioritized making the rules work right versus the notices immediately say the right thing. But that is the track that we're on. And I don't have an exact date for that, which is why the timeline currently says later in 2023. So sometime after July, but we expect it to happen this calendar year. Next slide, please. So here's an example situation that kind of puts all these different things that we've been talking about today together. Let's say we have someone, Sarah, who earns $1,250 per month, most months, but every year she gets additional business. So during the holidays, business is great. She actually makes double November through January versus what she makes during the rest of the year. So right now, she's eligible for OHP, and because of the special public health emergency rules, she has kept her eligibility for the past 3 years, even with going over income for a few months, which is something that technically you do have to report. And before the public health emergency could cause someone to temporarily lose their coverage and then get it back later in the year. We don't know when her renewal timeline is. Let's say if she comes up for renewal in June, she is eligible and will get 2 years of eligibility, but her notices won't say it at first because it's in June before we've updated all of our systems. However, because she's evaluated in June, she earns $1,250 per month and all of her other information. She lives in Oregon. We're assuming all that other stuff is also meeting with eligibility. She is going to be eligible moving forward. And then once we get our July rules updated, we're going to update her case so it has that too. And even though she goes over income in November, because we know she, like, this is a perfect world in which people make exactly the same amount of money and they know what they're going to make. Normally, before continuous eligibility, she would have lost OHP temporarily and not been able to get it again until her income went back down. But we know that we can now protect her from that situation. Just one last piece of this is to sort of talk about how this unwinding fits into continuous eligibility is even though the rules will be updated as of this December, at the time that she comes up for renewal, she will show as being over income because she's currently making that income that's above the threshold. So she would lose her OHP and be able to reapply in February when her income goes back down. And that's when that 2-year eligibility would start to apply. This is kind of a sticky situation with a few different hypotheticals, but just to show how the public health emergency, how our old way of doing renewals, and how our new way of doing eligibility and continuous eligibility might play together in a situation. So I know I just talked through a few different things and it's a little confusing probably. But that is an example of how, depending on when someone renews and when those continuous eligibility rules will apply for them, based on the public health emergency unwinding, how these all might align. And I'm actually going to pause for a sec and take a look at the chat to see if that's hitting or if I have maybe not used my words in the best way for this example. I do see that there's a lot of questions.
Sean's been answering a lot of them, so thank you. He's been quick.
There is a great statement I'm just gonna read out loud because yes. So do I hear correctly that continuous eligibility applies after people go through their redetermination renewal? And that is true. And so if someone goes, let's see, so in June, Sarah has gone through renewal. It's before continuous eligibility is in our systems, but she is eligible. If she's eligible in June, then in July, we can apply those rules. If she was over income in June, then she would close OHP. And a closed case doesn't get continuous eligibility because it's not eligible. So that's the difference in these situations, is anyone who was eligible now through when we turn on continuous eligibility and they've been through the redetermination renewal process, they'll keep it. And this is where all these things come together in a way that's pretty confusing and why we wanted to talk about it a little in detail. And so if anyone is redetermined and they're over income, they lose their OHP eligibility, and it won't be until they apply and are found eligible, maybe sometime in the future, that continuous eligibility would come into effect. And people will know that they're up for redetermination. The best way is a household has gotten that letter in the mail that either says, congratulations, you're renewed, or it says, we need some information, or it might say, it looks like you're not eligible anymore. And so those are the, either we need more information, we approve, or we may close, depending on a household's information. And I do think for folks who have been working in OHP for a long time, continuous eligibility, like it blows my mind anew every once in a while when I stop to think through it, because we're so used to situations where we say, oh, you've been on OHP for years, but you had, 3 months of really good income, and that means that we can't help you anymore. That's no longer the case once we are able to apply these rules. A change in income does not immediately cause a change in eligibility. And I think that's the part that's hard, is we're thinking through how we've always done business and what it means to be eligible. And the public health emergency really did change a lot of how we're able to think about eligibility. People can continue to be eligible even though their income is at a state where if they were to apply and they were not in our systems yet, they wouldn't get into OHP. So it's some protections that cause people to be able to have some additional flexibility in their household, and not worry about if that's going to turn off their OHP next month. Like, if I get an extra paycheck this month, is it going to affect my family's OHP next month? And the answer is, once continuous eligibility is in play, it won't, or at least not on an immediate basis. People have to have consistently higher income in order for that to affect them, and they have that 2 years of protection. Or for children under 6, up to 6 years of protection. And continuous eligibility is a part of our 1115 waiver. So that's how I got to sneak this topic in as a waiver update. So it hits a lot of different things happening at OHP. But a really important piece of this is that the federal government has given us at Oregon, at the state of Oregon, the ability to try this out for a 5-year period and see if we can help people keep their OHP, have positive health outcomes. And depending on how this 5-year demonstration goes, how our waiver goes, we might be able to keep this moving forward as part of our central OHP system. And so this is a situation in which our waiver is allowing us to try something pretty cool that we haven't done before. And it's a partnership between the federal government and the state of Oregon and how we're doing our rules. And I think we're getting close to the end of, I want to make sure we have time for feedback. I'm realizing we're running out of time, and I want to make sure this isn't all me talking at you. So I'm going to move us along, knowing that there's a lot of really great stuff that I can't talk and keep up with the chat right now. So I'm not going to try to do that. So let's move on to the next slide. And so I just want to introduce, I think there's a lot of great questions about how exactly all this is going to work for very specific populations. And I think that I can say that there are aspects of the waiver as well, some of which are still in negotiation, which apply to people who are incarcerated, people who are justice involved. So there is some information around that is still forthcoming and that I hope to tackle in a future webinar, but that we aren't going to be able to talk in detail about today. I do believe Oregon continues to be a suspension state, so someone who is currently incarcerated cannot have OHP, and that is true under continuous eligibility as well. And so there are some pieces about that. And also we can keep talking about continuous eligibility as long as it's useful to you all. So if there's more content or new ways I can frame this up next month, totally open to doing that. But we're down to our last 5 minutes. And I want to make sure people have an opportunity to let us know, not just the immediate questions you have, because I see that we've captured them and we'll be circling back to that. But we want to check and see, how do you feel right now about your level of awareness on the topics covered, knowing that this was kind of a teaser because it's a new way to put these different concepts together. We are using Poll Everywhere, so there is a pollev.com/OHACET website you can go to. And, oh, there it is in the chat. To see, how do you feel about your level of awareness on the topics covered? I can tell you I feel pretty strongly about your level of engagement because there's a lot of really, really great engagement going on in our chat right now. And wow, people are medium, quite a few people at somewhat high, somewhat low. I thank you for being honest. I find the more I am learning, the more I don't know, and I didn't know how much I didn't know. And I'm happy to see so far that people have at least a somewhat, they feel like they have some awareness. I think I'm going to move us along just because the other pieces are more interactive, and I want to make sure we get to those. But thank you so much for your input here. We want to give some time to ask the question we always ask, and I'm sorry for the hard left turn. I realize we have a lot to say and a limited amount of time to say it, but we want to continue to ask, how can we better reach you and engage with communities across Oregon? I do see a note, I want to say out loud, I see a note about things being contingent on our budget. That's true of everything at OHA. We are moving forward and we are building these systems with a fairly good understanding of what we expect to be in the budget for the next biennium. But OHA is part of the executive branch. We have a budget and we need to abide by that. And there's always a little bit of uncertainty when we go through long legislative session because we don't know what is in the final budget until legislative session closes. So there is that piece of the work that is built into many of the pieces that are state supported around OHP. So just as a note, there is a certain amount of uncertainty. We are building these systems to move forward, and we are ready. And I do see some folks are also responding in the chat to these prompts, and Poll Everywhere or chat, both are great. Seeing emails and more webinars. Just having these monthly meetings. Ooh, various and repeated modalities. Oh, that's great. Thank you all. Yes, including links to our website where we continue to update information. Thank you. This is probably a good time to remind us also that we are recording and this information will go onto our public website, and know that we are also working on creating more documents such as a FAQ, a frequently asked questions, to help us get information out between webinars or in addition to having this space here. And then our final question is, what topics around the OHP waiver would you like to learn more about in the future? And these questions that we asked here, I know we had to go through them pretty quickly. Just know that this is not your only opportunity to let us know what you want to hear more about, where you have questions, or what recommendations you have for how we can engage you and the folks you serve, and the folks in your communities. I know we have a wide variety of different folks in the room today, in our virtual room. We have members, we have assisters, we have providers, we have state staff who are all tuning in today. And then I think we're able to keep that is that poll still going in the background, Sully? Okay, so that poll's still going in the background, but we do also want to make sure you all have a link to our website about the waiver renewal process. We do have a listserv that I think is so close to being operational again. And we also have that waiver renewal email address, and you are welcome to reach out to that email address at any time. Everything that is, everything that's in the chat, we are saving and we are keeping track of. I cannot promise you that we'll be able to respond one-on-one to everything that's been said in the chat, but we will be building future materials, future FAQ pieces. We will be using it. And if you want to have a direct response, that's where I'm going to point you towards this email. This email is the place to get direct responses. We are getting that up and running at a faster response time now, I believe, than it was in the past, and we're continuing to work on that. And I see that a lot of folks have put information into the poll, put information into the chat. I know we're over time and you all probably have other places to go. I think I can stick around for a few more minutes. We'll keep the chat open. Thank you so much for coming. Please do not hesitate to reach out about additional things you want to learn about. And just know also that there are many other folks at OHA who are working on a lot of other moving pieces to this too. So we may not have the answers. We may be able to connect you to the folks who do. And I hope you have a great rest of your Wednesday. I do feel like this was sort of a teaser. We teased some concepts, but it would really take more time to really dig into them. So that's something noted. And we can probably stop the recording.